Mosaic Life Care held a conference today about how to stay safe from the respiratory virus RSV and how to identify and treat it. KQ2's Noel Harden has the story.
RSV is a viral lung infection that is mostly dangerous for children and older adults. It's most prevalent during winter flu months. Symptoms include excess amounts of mucus, trouble breathing, loss of appetite, and other flu-like symptoms.
The biggest symptoms that you're going to see in the little kids that you're going to want to worry about is if they're starting to, I call it panting like a dog. So if they're breathing really quick, or we're seeing where their ribs are sucking in, we call that retraction, or nasal flaring, where you're watching their nostrils just flare in and out. Those are the symptoms that when you see that, we probably need to be heading into the doctor's office or the ER to get some extra help.
For RSV, symptoms may seem similar to other viruses such as influenza or bronchitis, but what sets it apart is that it could be a gateway that leads into other viruses.
There isn't really anything that necessarily sets it apart. RSV can kind of be the lead-in point to a lot of those other things. It can lead to the bronchitis of the bigger airways, and then it can also lead to then a pneumonia. So it can kind of be a stair-step down that path. With RSV, it's kind of hard to pick it out from any of the other ones.
To help alleviate symptoms of excess mucus, Ball suggests nasal sprays or to make an appointment with Mosaic to get the mucus suctioned out.
The thing that you want to do is get some of the nasal saline, whether it's the Arm & Hammer or the Little Remedies nasal saline, do a couple of squirts and then suck them out afterwards. How that's going to help is that mucus and that snot gets so thick that that salt will help draw that out.
If symptoms are severe enough that someone is having trouble breathing or gets more sick, Mosaic recommends bringing that person in to get medically tested for RSV.
You're never going to be at fault for bringing them in and having a medical professional take a look at them.
Reporting in St. Joseph, Noel Harden from KQ2 News.
Mosaic recommends anyone who has these severe symptoms to get tested, especially those at higher risk, such as young children and seniors.